to what their concerns are and try to give them some ideas, maybe get them connected with resources in the phone. We can do it anonymously. People don't have to give us their information when they call. They can just tell my mother, my father, somebody, and I'm worried about them and I want to try to talk to them here. We have access to the language line that we can get connected immediately to a phone call to assist with that. I admit that's not an ideal way to be interacting and discussing, especially some serious situations that we're talking about, people who can be very upset and things like that. But we do have access to that also 24 hours a day, 7 days a week, so that we can try to provide the best culturally competent service that we can. Like I said, we don't have anybody in our office directly who speaks Nepali. I wish we did, believe me, but we don't. But we can connect with somebody who does during that time to try to help smooth things over.
Like specific data for the suicidal cases in the Dauphin County?
Search Dauphin County Coroner. You'll see that they keep annual reports, and they are.
They're I hate to. It's sad to say they're the ones who have that information. A lot of times we don't.
I asked that question is like I want to know like we have a lot of other community, so we want to know what here they resettle in Dauphin County as our.
Reports are broken down with that level of specificity.
These are vital stat records.
In Dauphin County are a pretty stable number. So they peaked and they to conduct grant-funded suicide prevention activities.
There are 54 in 2021. That doesn't mean that I think one suicide is more than that we need to have. And so compared to other counties, we're probably mid-range, but like our neighboring county in York, they have a high rate of suicide. Their rates are anywhere from 70 to 90 each year. So, but that doesn't mean we can't do a lot more than we're doing right now. And one of the things that we are doing and hope to do is discussing this. This is the first step. So one, I want to thank you all for being here, but I'll shut up for now and then wait till I get to my part. Suspension is the aftermath of what we do with suicide. So we know through research that if we lose somebody, we have to talk to the community. That's really one of my focused energies on in the next couple years, not in Dauphin County, but in Pennsylvania and across the country. In 2012, I started my own nonprofit 2 years ago because I wanted to focus on the things that aren't being done, like this. And if we focus on, there's like communities in the community. So if we focus on talking about suicide, because suicide is still that whisper topic that no one likes to talk about. But if we don't talk about, we're still going to lose people to suicide. So that's my goal, is to start the conversation, but also train. I train all over the country. And that's how I met some of these people involved in this room. Find out what the needs are of the community. To find out your needs in the aftermath. Do you have support groups? Do you have the right resources? Loss teams are local outreach to suicide survivors. So when a suicide happens, that a loss get them help as soon as possible. And loss teams are made up of other loss survivors. So there's many things that we can do. And also, support groups in the aftermath. There's a lot to accomplish and a lot that's not talked about. So I could go on about this subject forever. Can have an active, great life, even if they're in the throes of thinking about team together. That's going to work together for each and every one of you. And if we do that, we join us in trying to prevent more suicides. And don't think about even just prevention with people. There's usually one person that's having thoughts of suicide. So we want to help that one person, and we want to provide. I'll keep on going. So thank you very much.
We'll go back to maybe talk about
Organization Suicide Prevention Alliance, but my partner here, Jen Hines, she runs Team Care Behavioral Health, both in Dauphin County and Lancaster County. And she begged and pleaded for me to come and help her out because I'm really busy. But more so is that,
my only thinking is there is a big stigma on mental health that they think that if I go approach for help, I will be labeled. How can we break this barrier?
Can I, let me say real quick, we probably have 75 to 100
I know
patients?
that, yeah, I have referred them.
You, oh, you referred them?
Yeah, I
Okay.
have told them to go to seek the help.
Great.
But my thing is, first we need to know.
I am a practicing family physician. I work with Penn State Health. My clinic is in Colonial Park. Most of my patients are those that I have been working ever since they were sick. So it's a very complex, mental health is a very complex issue with our community. We have been discussing so many things. We have been discussing about making a group, making, all those kind of things. But the complexity out here is whoever we are trying to educate, these are not the ones who are committing suicides. So we might be training 20 people and educating 40,000 community. The rest 10,000 among them is the one who commits suicide. So it's a very complex thing. I think in 2010-12 there was a surge of suicides in the community. That time I think we had few studies done by the Department of Health in Massachusetts along with ORR and CDC. So that time I think there were very, very good suggestions, but we tend to forget those suggestions and then we slip back to the normalcy and in our daily life. In Harrisburg, we were jumping in the field, I think it was in 2017-18 probably, when one of our esteemed colleagues committed suicide here. So that time we thought we should be doing something. After a few months, few more suicides, and then I think it was practically on the cover, and then we went back to our business, and nothing happened till in the last 6 months. Again, the same thing happened. So I don't know the rate as of now, but I think with the Bhutanese community is about 20-22%, 20-22 per 100,000, which is twice the average national in the US, I think. And this has been, I don't know how they got the data, but this has been quite similar to that in the camp, also about 20%, 20 per 100,000. And this is consistently there, a huge public health problem. The basic problem is the mental health taboo, as he said. If we say
abuse issue, and it's usually among, I mean, it expands across all ages, I believe, but I think the difficulty that kind of takes people down the path of taking their own lives and they were thinking about suicide is the embarrassment of someone in their family being arrested or having an issue. Some of your older folks in your community just don't understand how to deal with that type of help that they need. Something that we're doing in Dauphin County, many of the police departments are doing, we're probably going to be bringing another one on board, is with our officers, we have a mental health co-responder. So in the mental health realm. Just in later in January, probably early February, that one of those positions will be opening up in our agency. And if there's someone in this room or in your community that has that type of background, they can actually be employed through Dauphin County and be assigned to Lower Paxton Township to assist. And believe me, we would welcome that because that would open the door to your community into the police department. Because most often we encounter people at their worst times. When they dial 911, it's because they're in crisis.
Away from the country, actually from the country where we have all the things, and that impacted a lot. While just taking out from the country, we just live in a long time in the refugee camp where there is a lack of resources, and like our life was so dark there in the refugee camp. And fortunately, like we are able to, our mental status, our knowledge, our lifestyles, everything came from the refugee camp to the US, where there is to be resettled, everything. So the same way, like cultural adjustments, including the language. We had the same one case recently, one of my PCP, and she had a pain on the back. She's not able to walk, and interpreter was given to her, and she was trying to say her things. Like she said that because of
They cover, I know someone mentioned the PQR, which is a great program is very quick. These are like all-day events, and you get a certification, and they're led by community members. And I do know of community members here who are trained in this. And if you'd like to have an event like that, that would be wonderful. They're very interactive. They're even a little bit fun, you know. And when we had these events, we had like food and entertainment and things. So it's just like
interviews that I listened to was not that different from what is just now being discussed here. Same issue. Pretty much, yes, we have.
Often the receiving end does not take it seriously. When my, for example, when a young person tells me that, I will consider that as, this kid throwing tantrum. She felt she would be better off dead. But it is, it's not very uncommon.
See more Bhutanese adults. So I'm not really sure what that is. Maybe it's because they have those kids under control. But
Or that the adults have more accumulated trauma since the country.
yeah, we see all ages. I mean, I've seen husband and wife couple that are in their 70s come in. So yes, so I would love to be able to provide more therapy for them, but now that I know of him, we can refer to DP, was that his name?
DP, yeah, he had multiple names.
Yeah, he had multiple names, multiple aliases, but I would love to.
Yeah, I know him as DP, yes.
Okay, yeah, so that would be good for us to have, because we do get a lot of, because of our location, I call it Little Nepal. We are surrounded.
Where are you located?
I'm on Dairy Street, so I'm.
That is Little Nepal.
Yeah, Little Nepal, so I'm right there, we're right there. We're next where Momo's Deli is. Psychiatrists that will see everybody from children to adults. We do not have a 6-month waiting list. We can get somebody in within 4 weeks to get in front of the psychiatrist to help. We use a translate. We don't use Language Line. We use another translation service that we use it through an iPad. So that works very well. We have had some issues with the dialect, but so far that's been pretty successful for us. And we'd be glad to see anybody that we can help. And Govind and I are partnered, train you guys in some QPR. Train the trainer. So we want to train, so that would be the goal.
Yeah, for our community members, if you're interested in being